मुस्कुराहट के पीछे का एक राज है, एक अच्छा डॉक्टर. So we have Dr. Altaf, orthodontist from Naseem Medical Center. Welcome to Radio Olive.
Yeah, welcome.
So, सबसे पहले, first of all, I really wanted to ask about what's the right age to consider braces for children?
Actually speaking, in the point of orthodontics, the right age actually starts from the day we are born.
Oh.
Yeah. Like we have different aspects in orthodontics. We have the preventive one, we have the interceptive, and we have the corrective side. Preventive, actually, you know that prevention is better than cure. So it starts right from day one. It's like you can see there are no teeth for a newborn, but some child will have, like we call it as a prenatal teeth. Some are born with a single tooth, like that. So especially the part we focus is on the gum pads. We call the gum pads, that is without teeth, we know the edentulous part. That is the gum pad. So how the gum part is positioned, that will determine the future face. That is how it starts.
Okay.
But as we say, like from the day one, the treatment or the preventive part starts. But most of us are concerned when the teeth arrives. So it will start maybe from the milk teeth. We could have regular checkups.
Okay.
And we have a transition stage at around 6 years, 7 years, where the milk tooth are shed and the new teeth are coming. So that is the ideal phase we get patients, and most of us are concerned because they see the cute face, they say see this milk teeth which are so sweet. So suddenly the parent feel that the teeth, smaller teeth are going to replace by bigger teeth, which at that moment may look a little awkward. So they are concerned, why doctor, the child had a small teeth but now he is having big teeth. Is it going to affect his smile, the face? Yes, like it is the preparation to his adulthood. That teeth should stay for the entire life. So considering that, how that big teeth is going to fit into a small mouth, from there actually the orthodontic point of view starts. So we have to make arrangements for the smaller jaw to receive the bigger teeth. So you could see some children smiling, some are having crooked teeth, little up, down, because they are not having enough space to sit into the jaw. So right from that, it starts.
And the example is me.
But for some it looks cute, no? As like in you, the smile looks cute. So.
Yeah.
So some maintain that, like for the cuteness, they maintain some teeth might be little up, down. But anyway, for the considering the general oral health, we should correct this. We should make the entire teeth aligned. It should be in the same line, one line, and it should coordinate with the upper teeth, and the lower teeth should coordinate properly, so that you will have a better chewing quality. Your general oral health is also maintained properly.
Okay. So what are the like some common misconception about braces or orthodontic treatments?
Basically, the orthodontic treatment means we are moving the teeth. We are moving the teeth within the bone. So a little bit of pain is part of the treatment, but that is to a tolerable level. It's not beyond tolerable pain or like that. It can be managed, but understand that this is a biology. The tooth is moving from one position to other.
Okay.
So definitely you will experience a little bit of pain, but manageable pain only.
Okay. So what habits should people avoid to protect their teeth alignment?
Most of the people we see, the regular question like this comes with the mouth breathing. Like most of them have, like when they are sleeping, the children especially, they do breathe through the mouth.
Okay.
So that will actually affect the jaw growth, that is the bone growth, as well as the teeth position.
Okay.
So that habit needs to be considered. Some children from the beginning, like you know, in the infant stage, they might be using the breastfeeding or the bottle feeding. Sometimes like they will continue the thumb sucking or the finger sucking. That may continue to maybe 8 years, 7 year, 8 year, 9 year. At that age, it is not normal. So that should be controlled. That is another habit which should be controlled. Some will have a habit of tongue thrusting. We call it tongue thrust. Like you can see when they speak some words, there is some lisping of words. That's because the tongue is actually not fitting in the jaw. So it likes to thrust outside. That is also another habit. All these habits adversely affects the growth of the face and the teeth.
Okay. And are the braces only for teens or even adults can?
Yeah, I told, as I told, no, right from maybe 6 years, 7 years, it starts. it can continue at 60 years of age also,
really?
provided the jaw and the teeth are healthy.
Okay.
That is, I told initially, the teeth are moving in the bone. So the bone should be strong enough to receive this movement of the teeth. So until any age, orthodontic treatment is possible.
Okay, okay. And then let's talk about Naseem Healthcare Khor.
Yeah.
So, like, if somebody wants to, correct their alignment or any other treatment, how can they, join, or how can they come?
Yeah, all are most welcome to Naseem Healthcare, the new branch of Naseem at Khor. We have different specialities in dentistry, not the orthodontics. So the treatment we provide in dentistry, we call dentistry, because we combine the different specialities of dentistry together with orthodontics to provide the maximum benefit of the oral health of the people.
Okay.
So once you come Naseem, you can just enter the 6 departments are there for the dentistry. You can start with the general dentistry. From there you will be diverted to whichever specialty you need to go, and accordingly we give the best of the treatment.
Okay, so are there any ongoing campaigns or offers?
Yeah, now there are promotional offers going on with Naseem, especially for the braces. There is a package of 3499 which covers the entire braces treatment.
Oh, wow.
And we do get monthly installments also, not in a one single shot we do the payment.
Okay.
And depending on the case difficulty, sometimes the price may fluctuate. But this is the basic thing.
Okay. Now let's talk about daily hygiene or everyday tips, So even we see in kids, they have, this, what we call this black teeth.
Yeah, black teeth, usually it's like most of the parents consider this as a lack of hygiene.
Okay.
But to an extent, it's lack of hygiene. In addition, there we have the chromogenic bacteria. It is overload of some certain bacteria which emits this sort of stains that will stick onto the teeth, which is difficult to go by normal brushing. So in that case, we have to seek professional help to get rid of that, and some certain amount of mouthwash will also help in this black staining.
Okay. And then what about like adults? We should visit regularly to dentist.
Yeah, it would be better. The price of a teeth is it's like everyone knows it. So it's better always to have a 6-month consultation to a general dentist. General dentist would be efficient enough to divert to the whichever specialty care he needs. The general dentist, you can see the general dentist to understand. Once in 6 months.
And what about scaling?
Scaling, it's like most of the people ask that we need a scaling 6 months. It's not like 6 months you should do scaling. It depends on the situation of your oral cavity.
Okay.
Some people will have thick saliva. Those people are more prone for calculus or the deposits. Okay. For that, you might need to go for 6 months in between scaling. But for the normal one, if you are drinking a lot of water and the saliva is like watery type, no need of 6 months scaling. 1 year or 2 year in between is okay. Okay. But it's not a regular deal. Yeah.
And then what should be our regular pattern to clean our teeth?
The most important is brushing.
2 times in a day or
2
just 1?
2 times is must actually, and with toothpaste you have to use. Toothpaste, any toothpaste is okay, but
we have seen a lot of advertisement. They say salt is important in your toothpaste. Is that
we can't say salt is that much. Everything is important. Okay. There are different brands going on with different levels of advertisement, but as from the professional side, anything that is a mild abrasive would be helpful.
Okay.
But you can see this gel type of toothpaste. The gel type has the more abundant content of these abrasives. So that actually looks good when after you brush it. It might show some shining, but with age it will become yellowish. Okay. So that is with this gel. It's always to go with the dental cream. That is the white color. That is the normal. You can see that it is mentioned dental cream rather than any gel, any charcoal. That all are this just marketing side only. Okay. So first treat what is the reason, treat that reason, you will have the best result.